Okay, so I don't have a patient to do an assessment on, so I'm just going to go over this and talk about what I would do if I did have a patient. So in the case study, it was a 73-year-old female who had fallen at the grocery store and hit her head, and so she had gotten a subdural hematoma. Her husband reported no loss of consciousness. So here's some of the things I would do to assess her when she's in the hospital. So I would do a neurologic assessment, which is different than a neurovascular assessment, which I'll talk about in a second. But I would start off by doing level of consciousness. So I would kind of ask her a couple questions to see if she's oriented. So, well, first I'd see if she's awake, able to speak. So I would ask her what her name is, her date of birth, if she knows where she is, and then just a random question, like who is the current president? And so if she gets all four of those correct, then she's awake and oriented times 4. So a couple other things you can do is a mental status assessment, cranial nerve assessment, and pupillary response. So I would take my pen light and I would just have her look at me, and I would put the pen light in each of her eyes as she's looking at me so that I'm not pointing it directly in her eye. So I'm looking at her pupils and making sure they're the same size and that they both constrict when the light goes towards them. And then I would also do accommodation, so I would put the pen light closer, like by her nose, to see if they go in. So I would report that as PERLA. So pupils are equal, round, reactive to light and accommodation. Another thing I could do is the Glasgow Coma Scale. So a couple things that entails is, once again, eye response. There's verbal response, so that also includes orientation and speech. And then there's also motor response, but that is something that the neurovascular assessment includes, but we're just doing neurologic, so we wouldn't be doing motor response, such as like response to pain, stimulus, like obeying commands for movement, things like that. But everything is scored with points. So then after you get the points, you would add them up, and then whatever your coma scale score is, you would check the classification. It would tell you the severity of the head injury. So that's pretty much it. Once again, I did not have a patient to do this on, but those are the assessments that I would do on this patient for the case study.